recent outbreak of lassa fever is a serious threat to the lives and economic viability of Nigerians and Nigeria. Lassa fever was first identified in Lassa town in Borno State. The disease is transmitted by a multimammate rat. Also note that the disease is endemic in Nigeria, with periodic outbreak associated with higher mortality. Further note that from 1st January to 15th of April 2018, a total of 1,849 suspected cases has been reported from 21 states according to World Health Organization, out of which 413 were confirmed. There were 114 deaths with case fatality rate of 25.4%, among which were 8 medical and health workers. Worried that between January 1st and 24th of this month, a total of 195 confirmed cases were reported from 11 states in the country, with 29 deaths, as reported by Nigeria Center of Disease Control, and the figure is likely to rise. And among the mortality were also doctors and other health workers. Also worried that despite Nigerians' ability to effectively and timely diagnose samples of suspected cases, there were only 5 laboratories with the capacity to diagnose the disease in the country, of a population of almost 200 million. Further worried that despite the population and land mass of Nigeria, with a lot of environmental challenges, there are only 3 main treatment centers for Lassa fever in the country. These are Irua Specialist Teaching Hospital, Federal Medical Center O, and Alice Ekweme Federal Teaching Hospital, Abakaliki. Cognizant that the disease is endemic in Nigeria with a periodic outbreak, the emergency preparedness to handle outbreaks should have been optimal, with an improved capacity of medical team, wide availability of personal protective equipment for health workers, and higher level of researches toward elimination and control of Lassa fever. This is to ensure prompt case diagnosis, management, and other response activities, thereby reducing the number of deaths. The House therefore resolved to urge the federal government to declare state of emergency on the control and prevention of Lassa fever outbreak in Nigeria. 2, the House also urged the federal government to provide at least one fully equipped center with capacity to train personnel, diagnose, support, provide care and treatment for Lassa fever per geopolitical zone in Nigeria. 3rd, urge the Federal Ministry of Health to adopt collaboration in response to the epidemic with relevant key government ministries and departments in the control of Lassa fever spread. 4, to also urge the government to ensure adequate compensation of all health workers that die or fell ill due to contact with disease while rendering healthcare services to the citizen. 5, to direct the House Committee on Healthcare Services to investigate the level of federal government response to current epidemic and report back within 4 weeks and ensure compliance with the resolution. I so submit. Mr. Speaker, let us just to remember that Lassa was first identified in Nigeria. It is expected at this time, after so many years of researches and then identification in Nigeria, we should have been masters in management of care and control of Lassa fever. But unfortunately, whenever Lassa struck the country, we became so destabilized, so disorganized, that we cannot effectively come together to fight our disease. We need a multifactorial approach, just as it was applied during Ebola. In Lassa, we need a higher index of sufficiency, and the practitioners are trying to do that. What comes next is isolation. Unfortunately, if we are to go around most of our hospitals, isolation centers are not optimal in terms of the capacity to handle cases. Most of these isolation centers in our hospitals lack personal protective equipment that will protect the doctors and other health workers in managing the case. And thereafter, after isolation, you need also to take sample to confirm cases. Unfortunately, as mentioned, only 5 laboratories so far can effectively confirm cases of Lassa fever. What is the challenge? It means there's going to be a lot of sample of 100 that will be waiting and this will prolong the time to confirm diagnosis and thereby further exposing patient risk or unnecessarily isolating patient that is not positive. After diagnosis also comes the care. The care and support is also, we need to have a capacity that health workers can actually manage cases successfully. And then after the care and discharge, we should have a mechanism that will reduce the stigmatization of managed patients so that they can also be incorporated fully back into the society. Otherwise, they may tend to suffer stigmatization. Therefore, there is need for the country to have at least one geopolitical center that can effectively tackle the issue of lassa fever in Nigeria so that can provide both capacity for training, management, and case diagnosis. The issue of waiting for only 5 laboratories to serve 200 million people of this country at a time of emergency, I think, call for a question. And I therefore hope that the House will support this motion so that we can effectively handle cases of emergency whenever it arises. Thank you very much, Mr. Speaker, for giving me the chance.
Those in favor of the motion, please say aye. Those against, please say nay.